From a humanitarian response perspective and based on our limited experience as Kurdish Red Crescent, I can say what happened in Sweida is very similar to what we witnessed in August of 2014 in Shengal. I'm talking about the Yazidi genocide. There is similarity in many aspects. For example, the sieging on this area or region. Until now, there is siege on all the region of Sweida. The people cannot leave this region. The massive displacement within this relatively small area, we are talking about more than 200,000 people who must be displaced or leave their houses and villages, especially in the north part of Sweida. We are talking about the limited or the absence of the humanitarian response to this crisis. Of course, not mentioning the massacre that was committed against the civilian in Sweida. And the only difference I can say is in Shengal, at some point, there was a humanitarian corridor between Shengal region and North Syria. The people could flee and go out after some weeks. But in Sweida, after 100 days, the people cannot leave this region and they are still besieged. Since we didn't have an access to Sweida, we started to work remotely, relying on the local community and groups of volunteers. Of course, it was very chaotic at the very beginning because the people lost their houses, they lost their villages, they lost their families. But after the ceasefire was announced, we focused on supporting the local community and the local market by supporting groups of farmers so they can support the local market, for example, with fuel and transportation. Also, we supported some ambulances just to transport the injured people to the National Hospital of Sweida, which was itself under a lot of destruction at the beginning. So this was our main activities we started at the very beginning. Of course, after the ceasefire and once the situation was calmed down, we attempted to travel ourselves. But despite all the efforts, we were not able to get the permissions from the transitional government from Damascus, and that's due to the ongoing tension in that region and also the bureaucracy that was from the transitional government. So we keep working remotely and more in partnership or collaboration with the local community, local initiatives and NGOs. For example, one of our main ongoing activities is supporting one of the medical centers for cancer patient called Hope Center by providing chemotherapy and treatment for almost 1,500 patients. Those are in need of chemotherapy and unable to travel to other parts of Syria. Another activity is we are carrying out in partnership with an NGO called Sanat EFAO. We support the local community kitchens. There are, for example, 4 kitchens that we are supporting together, of course, with the group of volunteers from the local community, and every kitchen is able to offer between 500 to 1,000 meals per day. We also support another initiatives, for example, a wheel in Sweida with the solar panel energy, and of course that's due to the severe fuel shortages. We are also collaborating with the Health Directorate in Sweida by supporting the public facilities as they ask us and covering the gap that they see. We are working together with them and we target mainly 4 hospitals, I can say, the National Hospital in Sweida, Sarkhad Hospital, Sali Hospital and Shahba Hospital. Also, we are planning together in the coming month to target the displaced people with the chronic medication, and of course, because it's getting cold, to target the children with the acute medication, especially the diseases that caused by the cold. We really hope that the siege will be fully lifted soon and that those people who were forced to leave their houses will be able to come back to their houses and to return to their villages. because we think lifting the siege will have much more and greater impact than any humanitarian effort that we or any other organization can provide.